Living on the border, it would seem hard not to notice the impact that global trade and industry is having on us all. We tend to get so immersed in our worlds that we often don't have the time to just sit back and really look at it.
He got a permanent full-time job in a company and thought that, that's good. You'll be able to have a family, have a good income, and, all those things. He would say to me sometimes, I'm tired, just feeling tired. And he was always physically fit.
What we're seeing happening with the increased integration with there's so much trade, and 80%, between 80 and 90% of our resources and our products going across the border. What we're being told as worker by our own leadership in the labor movement is we have to accept a certain amount of sickness. We have to put our bodies on the line and basically mortgage ourselves, our health, in order to maintain our livelihoods.
Windsor, of course, is by far the biggest Canadian city that is right on the border. So, and of course, Windsor is very strategic because you're talking about something like 40% of all Canada-US trade takes place between Windsor and Detroit.
Rash on the back of the legs, toes, skin peeled away. See, we had it in the triangle at one time.
And it's normal to have, say, 2 or 3 colds a year or something. Right? No, I mean, you know what you'd expect here, given all the pollution, that we would have chronic respiratory stuff. I mean, I would think we would, right? And if people's immune system has been compromised, might be another dynamic. But anyway, I think from the way you're describing it, it's not just a usual, a normal kid thing.
No, it was horrible.
I have 2 daughters. My youngest has been recently diagnosed with asthma. And we've been told by our doctor this has everything to do with you living in the dirtiest city in Canada. I'm very concerned. I'm at the point of not wanting to have any more children. This is how concerned I am.
When you look at how long people are likely to live, longevity and health, it has an enormous amount to do with your position in the society and your ability to get away from the effects of industrialism. Class, actually social class, is the best indicator of how long somebody's going to live. Forget about, who your father was, what your father's genetic problems were, whether you are fit, what kind of diet you eat. The number one factor in determining longevity is social class. And one of the main reasons for that is that people in the upper classes get to choose what kind of environment they put themselves into. And there's not a lot of concern still in our society with actually getting at the problems of people in workplaces and in the kind of broader environments in which they work. And unless we change that, we're just not getting at the realities of these kinds of metropolitan centers.
clouds meaning right beside you there?
Usually that's psychosocial, like, psychological problems
Okay.
or whatever.
Now we're doing a process with assisting the First Nations community in Sarnia, the Chippewas of Sarnia. And what we have here actually is only dots representing health problems that they're interested in investigating. We've developed a whole questionnaire with them. And these are really looking at dots for 3 families, looking at male and female children under 16 and male and female adults.
Like, I'm very concerned about this if this is a common condition of the arm problem, or the loss of circulation, or is it neurological? I don't know.
I know my chest comes across here and then it comes through here. Yeah.
It's kind of a hypothesis. They're very concerned about the health of their children. They're very concerned about the impact of exposure to environmental pollutants that they've had for years and years. And they are probably they are without question, the most developed section of the Sarnia community now that's really starting to face this long-term, potentially very serious long-term problem of having had these environmental exposures from the petrochemical industry for decades.
This is representing 2 different spots though.
Back of the legs and toes? Well, if you want to put it in there and we indicate that, make a note of it, that every time we put the skin rashes into the triangle, it's more than 1 spot. Right?
What
the young
are
teenager
our
had a baby.
small yellow dots mean over here?
The little yellow dot is lost child through death.
So
What
the
is
light
that?
green rectangle is a digestive problem, but what's the small green dots?
Oh, we put the dot on top of the green triangle or rectangle.
Right. Oh, here's small green, had birth defect. You get feelings inside of you, hang on to it till you get outside, do whatever you gotta do to forget it. Push it to the side and we'll worry about it again.
You're having some very heavy interactions, aren't you, in people's homes?
Yeah. But I save it till when I leave.
Now, this
try
is-
it, it's hard.
He's diagnosed with mesothelioma and a kidney tumor, to which they say, oh, that's rare. But, gee, funny, I met 3 people almost immediately after who diagnosed with the same problem with the same issues.
In that special article that was written in 2004 in the Globe and Mail about Sarnia, it was reporting about the epidemic of asbestos, particularly asbestos-related deaths and disease among workers in this community. It was referring to an historical experience in which workers here working in the petrochemical industry and in a number of factories and employed as building trades workers, skilled tradespeople and so forth, as well as chemical workers, were exposed to a whole range of toxic substances, but the one that had the most profound effect, as I mentioned, was asbestos. We in this clinic literally have documented thousands of workers with occupational health problems over the last 4 or 5 years.
No warning. No warning. When I look back now, you can certainly see some signs, but on a regular daily basis, one would never have picked it up. He'd been on a 6-year strike. He'd lost a bit of weight. Okay, and he never was a big man, but
this is prime evidence, I think, of the general perspective, public health perspective, that particularly blue-collar workers are bearing an excess cancer risk, both disproportionate in terms of their numbers in society, but also totally preventable. And what we've uncovered here in Sarnia was a long period in which hazardous exposures were tolerated, and the government remained essentially silent. And now, in the wake of the 21st century, we're beginning to see, graphically, the impact that this neglect had.
mesothelioma, what do you want to say? What do you want to show? He said, I want to take my shirt off. I want people to see what this disease has done to me. Because when you look in the mirror, you see yourself. But you really don't see yourself sometimes. He hadn't looked in the mirror for a long time, and when he actually looked in the mirror after losing 30 pounds and seeing himself, he cried. He said, I want them to see what they've done to me, because I didn't go to work to die. No man goes to work to die. So tired of hearing people say, oh, I'm so sorry. Okay. Could you tell me about, oh, I'm just really sorry. That wasn't answering my question at all. I'm really sorry. I had one doctor say to me, and I said, well, what does this mean for Blaine? Oh, I'm so sorry. I said, well, I'm really glad to hear that you feel this way. Thank you so much. But what does that mean for Blaine? He said, well, what do you know about this? I said, I know it's terminal. Okay. But what does that mean for Blaine? How will this work for him? It's like setting off on a trip and you don't know anything about it. All you know is, oh, I'm so sorry, it's terminal. Okay, but there's a road that one must travel.
The Ambassador Bridge is by far the most important link between the two countries in terms of the economy. The whole auto industry in North America between Canada and the United States runs through Windsor, or a very large part of it does. So it is a pretty unique situation. And of course, Windsor's had all kinds of unique problems. After September 11, when you had those great backups, which still continue, of trucks going across the border, there's been a huge environmental impact on the people of Windsor as a consequence of that.
Sarnia is a border community, as Windsor is. Both communities are industrial communities, blue-collar communities. Sarnia is the center of the petrochemical industry. Windsor has been the center of the auto industry. Both of these communities are economically in flux. And our relationship to the United States in lots of ways are very graphic here. Their companies dominate the horizon. Almost all the petrochemical industry is American-owned. All of the auto industry, pretty much, at least in the Windsor context, is American-owned.
This company actually started up one of their derelict plants in the States, and they took equipment and everything across the bridge. Nobody stopped them. They didn't need this company anymore. They fully intended to put this company out of business. And they don't clean it up.
When people talk about globalization, they talk about the borderless world, this famous phrase that somehow or other the world is opening up and people can freely cross borders, ideas can cross borders, everything can cross borders. It turns out that in reality, The main thing that gets to cross borders is capital. Capital gets to go from one country to another. Capital gets to flee from one place to another and take jobs with it.
If the broader community doesn't support them and demand, and as well they should, because it's not just this community that's getting exposed from this stuff. These pollutants go everywhere.
I see that we've lost, as workers, we've lost the ability to have any kind of say over our foreign policy in this country. I think that NAFTA has proven to us, and the FDA has proven to us, that we have lost the capacity to have any say over what we breathe or what we ingest.
I don't know concretely what changes are possible in this environment. I think that the possibility of change always rests with the populations that are affected. So I think it's a discussion that really has to go on within these communities about what they want and need to live the kind of life that they want and need.
He certainly didn't feel that it was going to stop just because he made a statement. And Blaine only did what he did so that people could know that it was out there. The stories that were in the paper were not about him. They're about what's going on in our community for every man, woman, and child. And that you should be aware and start to ask questions on what about me, and is this okay for me? And if you've been given information, you make the choice. But you're not going to know it. Like, you sit back and be like everybody else. Keep it the dirty little secret. You need to talk about it.
It's not an easy time for working people to do this because of the changes in our global economy that, make it possible for these corporations to move all over the place and come, send their stuff back in and so on and so forth. But even in that weakened position, people still resist. They still want something different, and they are still working to make a better world.
By taking some distance, we can emerge and see the world as we never have before. And ask ourselves, is this really how we wanted it?